terms of the importance of our county working regionally and in partnership, this is a very well-known slide. We call it the spaghetti hoops diagram, which just clearly sets out all of the strategic changes that are taking place currently across Wales, but also into England. A number of the services that we purchase in Powys is both from within Wales and across the borders, particularly with Shrewsbury and Telford Trust, Robert Agnes Hunt and Wye Valley Trust as well. Some of the examples of some of the sort of significant changes that are being considered: the configuration of stroke services in Hereford and Worcestershire, and obviously the ongoing work around Future Fit and the hospital transformation programme in Shropshire and Telford. And I know that Carol and Steve will probably reflect a little bit on the plans both in North Wales and also in Hywel Dda as well. So, you know, our statutory duty in Powys as a health board is to make sure that because our patients are receiving care from a number of providers, that we engage and consult with the public on any service change proposals that have an impact on the population. And, you know, I'm sure you're aware that all areas in Wales have developed plans, but unfortunately, no health board currently is able to meet the statutory duty to break even this year. And there have been changes to the escalation status of a number of organisations, including Powys, where we've now increased from routine monitoring to enhanced monitoring. So it's really important that we work not just within Powys, but regionally and nationally in tackling that agenda. The next slide just gives you a quick overview of the long-standing plans that we've had in place. Our current 3-year plan is shaped, as I said, around our long-term strategy, and we've got 4 wellbeing objectives: strong activities around focusing on population health and well-being, early help and support, in particular working within Powys with primary care, strengthening diagnostics, admission avoidance, and the work around planned care. And then, very important for us, we set 4 priority areas to tackle. That's cancer, respiratory, circulatory and mental health priorities, and that features very strongly within our plans. And then a final element is how we work together to deliver integrated care across the system, so joining up where we can. There are a number of enablers as well. One of the key factors for us is how do we attract and retain the correct workforce to deliver the models of care in Powys, and some of the digital first solutions like Consultant Connect. Some of the requirements around how technology can assist us is a really core part of the plans for the future. We know we've got the most aged estate in the whole of NHS Wales. Most of our NHS estate predates the establishment of the NHS, so we've got substantial work to do to create fit-for-purpose facilities. And then finally, how do we transform in partnership at a system level? What I was going to say around this is that this work is currently being revisited at the moment now in light of some of the additional challenges that we're facing. But clearly, I think the main guiding principles that we set, which are the 6 along the left-hand side here, which is do what matters, do what works, tackling those with the greatest need, offering fair access and being prudent, still are the guiding principles that's supporting us as a board to develop the right proposals for the future. In relation to the accelerated sustainable model, I did mention to you earlier about the position that we have been undertaking sort of to develop a model for the future. And I think that it's important for us to say that as a health board, although our requirements is to submit a clear operational annual plan and a 3-year plan to Welsh Government, we have agreed as a board that we do need to actually work within a 5-year planning horizon to address the challenges that we're currently facing. And the significant shocks that we've managed as a system, in particular the pandemic, rising inflation, the cost of living crisis, all of these factors, we have been working very closely to get the right evidence base together to design the model. And together with being at the forefront of an ageing population, with more people living longer with multiple conditions in a highly rural area, where we've got a third of the people that live alone. This has led to a situation in which currently health and care services, people are experiencing delays to treatment, and also those who are delayed in hospital, deconditioning and weakening in hospital, and with the growing workforce gaps, including support at home, there are issues across the whole system. And this is why we are checking and sharing some of those emerging solutions with yourself. So I'm really interested, I haven't had time yet to look at the posters, but really interested to understand what are the opportunities to transform and to do things differently for the future. To help people stay healthier for longer and to keep living at home wherever possible is a key priority for us. And how we work with communities. I was particularly interested in the last presentation around the actions around trust and how do you build the right relationships. I think we've got a lot to learn on that, and I'd be interested to get your reflections about how we do that in partnership with our staff, but also with the broader communities. And then my final slide, I felt it was important. I won't steal people's thunder because some of these things will come up later into the joint committee, but I thought it was really appropriate within today's conference to reaffirm that Powys Teaching Health Board continues to be committed to working in partnership across the Mid Wales region. And the work that started the Marcus Longley report, and I know this is all historical, but that strategic importance of where we see Bronglais General Hospital for the region is fully supported alongside, Betsy and other services that are available. Kate Wright, our medical director, is leading the Mid Wales Clinical Advisory Group. And again, there's a really strong passion and commitment from clinicians across the region to develop and deliver new pathways of care. We do feel we've got a number of assets in Powys that we could use better if it was seen as a system asset, particularly our theatre, endoscopy and outpatient capacity. And we're really keen to work alongside you to make sure that we make best use of those facilities. So how we do that in partnership will be really important. Now, finally, just a couple of points. I know that the situation currently is really challenging, but I think when I come to events like this about how people embrace change and find different ways of working in very difficult circumstances is really inspiring. So I know tomorrow you'll have the Bevan Commission here talking to you about the public conversation about the future health and care model for Wales. And I think the rurality factor is a really important aspect for us to reflect on. And I'm really looking forward to working alongside you and others to how we can work nationally to refresh a healthier Wales as well. So those are my initial reflections. Hope that's all right. And I'll hand you over to Peter.
Thanks for that, Hayley. Thanks very much. We're going to move straight on then now, if that's okay, to Carol Shillabeer, Chief Exec of Betsy Cadwallader. So I hope she's online. Yes.
I am. Thank you very much. Pranawn da pawb, Carol Shillabeer ydw i. I'm Carol Shillabeer and I'm the Chief Exec of Betsy Cadwallader University Health Board. It's lovely to be here. But for all of the years that we've worked together, of course, I've been in Powys and I occupy a slightly different place now in our partnership in Mid Wales. So, but lovely to be back, and thank you again, Peter, for inviting me to contribute. So, and I've been in North Wales for 6 months after a wonderful 14 years in Powys. So big hello to all my Powys colleagues. Lovely to see your names in the sidebar and to hear the work that you're doing. It's certainly been a turbulent year for the NHS. I don't think anyone could argue that as we come through the pandemic of a century. We have real challenges around how staff feel and terms and conditions pay in the context of a really difficult financial position for the whole country, let alone public sector. So a very turbulent year, and particularly turbulent, I think, for health services in North Wales. Hayley just referred there to the level of escalation of all health boards in Wales, and Betsy Cadwallader back in February, the end of February of this year, returned to special measures escalation. And I joined the health board just a little way into that in May of this year. What I thought might be quite helpful is just to set out what are we working on as a health board in North Wales, and where does partnership and working together feature. So the first thing that we did as I came into the health board was to be really clear about the outcomes that we're trying to achieve as a health board, and there are 5 key areas that will help us to be a stronger, more effective organisation. I hope a great partner to work with, and importantly to improve access, outcomes and experience for citizens. So the first outcome is a fully functioning board. I think it's pretty unprecedented, the level of change a single organisation has had in its board, and we are building a new and fully functioning board here in North Wales, one that can embrace partnership across Mid Wales, but even beyond that footprint as well. So we're still in the process of doing that with appointments into the chair's role, into the chief executive role, which is announced today, but also into other independent member roles, and soon to follow other senior leadership roles. What we're really clear about is our commitment to working with staff, with partners and with communities. Wales is a place of community, and I certainly hope that if you're listening from one of our communities in North Wales, that you will feel that we are there as your health board to have that dialogue with. I'm going to come back to a bit of that. The second outcome is a clear deliverable plan, and it's funny, Hayley, you mentioned Marcus Longley, because actually that work drove some really good thinking about the areas of tangible work we could do together, underpinned by what it is that the public and our communities value most. So I think going back to those days of planning, we've come a very long way as health boards in Wales, and I think our level of interaction is significantly different to those days gone by. So a clear deliverable plan for the people of the region, and working with partners was one of our key outcomes, and we're really making progress on that. The planning landscape moving forward is very challenging, and I would just sort of indicate and underline some of those messages heard already about the changing needs and the demographic of the population. We heard only this morning on the BBC News about diabetes, for example, and the increases there. So the needs of people are changing, and the more we can focus on keeping well, focusing on health and well-being, as well as health service provision, as in ill health service provision, the better we will be. That's important not just because we all want to stay healthier for longer, but because of the available resources to the public purse. And we are really quite constrained. Plus the important factor of the workforce and workforce availability. And I mean that not just in terms of the statutory sector, but also in terms of volunteers or people in our community. And let's remember that it is volunteers and family members who provide the vast majority of care to people in this country. So that's number 2. Number 3 is stronger leadership and engagement. And I hope that already you've got a strong sense of a renewed focus and determination that Betsy Cadwaladr University Health Board will be an outward-facing health board. It was great. I was in Llandudno Community Hall relatively recently doing the annual general meeting, meeting people who wanted to have conversations about the things that matter most to them, wanting to have conversations about the future. The same when I was in Llangefni recently, and I'm sure when I'm in Tywyn next week, we will have those same conversations. So that engagement is really key. The fourth area is improved access, outcomes and experience for citizens. That's often the acid test of where people make their judgments about the NHS and about how effective it is. It's that personal experience. How long did I have to wait? Was it easy to navigate? Did it help me fix my problem and my issues? Or at least did it help me to manage them better? And then importantly, did I feel cared for and did I feel valued? Now, that's the same whether you're a citizen accessing a service or whether you are a staff member or a partner. That experience and feeling that sense of achievement is really key. So that's really important for us And then finally, in our 5 outcomes is a learning and self-improving organisation. And it is events such as these where we top up the tank of ideas and energy. We learn from each other what's gone well and what hasn't. I think seeing failure sometimes as a friend is very helpful. So let's share the things that don't go quite to plan as well. But we're very keen that we learn from others and we learn from ourselves. And just a couple of examples that I want to give, because I think if you're looking up Betsy Cadwallader on Google, you'll find plenty of things that don't go so well. I want to tell you about a couple of things that are going well. These are just examples, and I'm sure every organisation has these. The use of AI in pathology is diagnosing people more quickly, more effectively, 30% more effective in diagnosing cancer. That is making a huge difference to the speed with which we can support people in their diagnoses, and of course, for those who sadly have a difficult diagnosis, in access to treatment. Renal medicine, where I started in the NHS, undertaking research into how to improve the well-being of people who are dependent on dialysis. And overnight dialysis is giving people a new lease of life. And then robotic guided surgery, day case knee replacements, people up and walking down the corridor 3 hours after being on the operating table. Never in my career could I have imagined this to happen. This is all happening in our area, and I think we should be really proud of the achievements. We will only tackle the challenges of our communities if we work together. The Mid Wales relationship is one that has lasted through the years. There's been bumps along the way, but it has lasted, and I hope that this annual injection of commitment and energy means it will last for many years to come. And I want to make a particular mention of partners of the NHS, the third sector, local government, housing, and people in their own communities. It is with your help and support that we do keep these partnerships moving, and a real focus on community-driven outcomes. So I'll probably leave it there at this stage, Peter, and look forward to questions, because I think we're handing over next to Steve. Diolch.
Thank you, Carol. Thanks for that. And now we're going to go over to Steve Moore, present Chief Exec of Hywel Health Board, and the lead Chief Exec for the Mid Wales Joint Committee. So over to you, Steve.
Yeah, thank you, Peter, and Borodar Conference. I'm delighted to be able to join you this afternoon. I hope it's been and I'm sure it has been, an engaging and interesting day so far. I don't have slides because I don't trust my IT skills, so apologies for that. Also, apologies that I'm doing this via Teams. My diary today required me to be at either end of the patch almost at the same time. So as I commented, I think at the last conference last year, our ability to be virtually present when physical presence is not possible has really come to the fore over the last few years with the pandemic, but it does have its downsides, and I am really sorry I can't be there in the room with you today. Actually, I hadn't seen what Carol or Hayley was going to say, so this might feel like we're comparing notes as I go through mine, but an awful lot of common thinking between us, which I think does reflect, as Carol said, on the years we've been working together in the Mid Wales context. But as Peter's already perhaps slightly alluded to, given my news yesterday about the fact that I am going to be moving on and returning to my home county in Devon after 9 years in Hywel Dda, I kind of hope the conference is going to forgive me if I'm something of a reflective person today about what's been going on over the last 9 years for me. As both Carol and Hayley mentioned the Marcus Longley report, it was just a couple of months, I think, before I took up post in January 2015 that Professor Marcus Longley published his Mid Wales study. Its findings and recommendations feel like kind of old friends to me, and they've really guided our thinking in West Wales. For me, the report was probably at its heart a plea from our communities in Mid Wales, for the public sector in general, and the NHS specifically, to work better across boundaries, to provide for the unique challenges faced by those living in Mid Wales. It was also a strong call, I think, to put the design and delivery of rural health and care on an equal footing with more urban models. This conference has very much been at the forefront of driving that rural focus, bringing together those on the front line with public sector leaders, with academics, and indeed our local population to try and drive that change. I hope that the continuation of this event becomes a lasting legacy of Professor Longley's work. From a Hywel Dda viewpoint, a core message of the study was the strategic importance of Bronglais Hospital to the Mid Wales area. After years of doubt about its future and the slow attrition of services that result from that doubt, the publication of our first ever strategy, A Healthier Mid and West Wales, confirmed, I hope in the clearest way that we could, that Bronglais had a long-term future and should be supported to flourish. It hasn't been plain sailing, as many of you will know, by any means, and there have been some setbacks along the way. But I hope, as we sit here today, the hospital feels to be on a firmer foundation, with plans to develop and expand its services still further. With your indulgence, I wanted to mention a couple of highlights over the last few years. For me, maybe the most standout one was the opening of the School of Nursing in Aberystwyth. I think it's probably been one of our most significant developments that I've seen. I remember when I first visited Bronglais, I think it was in February or March of 2015, visiting the wards and hearing about the level of nurse vacancies that we had in the hospital. 60% vacancy rate on one ward, which is more than I think I've ever seen in any other part of my career. And of course, this challenge wasn't just limited to Bronglais, it was being felt across the Mid Wales area, from Tywyn to Newtown, for example. As a result, I had great pleasure a few weeks ago, sorry, as a contrast to that rather, I had the great pleasure a few weeks ago to speak to the second cohort of nurse students starting their studies in Aberystwyth. There were about 90 of them from our local communities, from across the UK and indeed from across the world. And importantly for Mid Wales, it's given opportunities to local people to realise their dreams of becoming registered nurses in their local area. With the current Vice-Chancellor Elizabeth Treasure soon to retire, I want to pay tribute to her vision and tenacity to create something which will provide a strong foundation for services across Mid Wales into the future. The second highlight for me was the way our staff, partners and communities pulled together during the pandemic. In many ways, Mid Wales led the area. I remember Ceredigion Council was one of the first mainland areas to start contact tracing in the very early days of the pandemic. Indeed, even getting on the front page of many of the Sunday broadsheet newspapers across the UK. We saw in those difficult months how the public sector and local communities could pull together to support each other. The clearest demonstration I have of the cohesion that we have across the Mid Wales area. And whilst the recovery challenge ahead is huge, I think this sense of togetherness and mutual support will help us to succeed. And there have been, of course, a whole range of developments in Bronglais, some of which Hayley mentioned in her slides, and the wider area. For example, the new MRI scanner being installed. I remember the day it was being craned into Bronglais. I couldn't watch as it was being craned over the entire building. But putting that in place has prevented people from having to go on long journeys for their scans. To restoring our colorectal surgery in the Mid Wales area. Indeed, the appointment of our second surgeon in this specialty has, I believe, now put this service on a firm footing for the future. And we have our first consultant rheumatologist for Mid Wales who joined us last month. And I think that's hugely encouraging for the future. There is so much more I could mention, much of which is covered in the Mid Wales Joint Committee meeting later today for those of you who can join us. But I know today I'm probably slightly pushed for time, so I won't go on much more on that. But looking to the future, we should expect to see the School of Nursing go from strength to strength, and I hope start to widen its educational offer to other professional groups. This is going to provide a pipeline of staff long into the future to support not just the acute hospital, but services across the whole of Mid Wales. We also have the redevelopment of the chemotherapy unit, which will provide a much needed boost to the way in which we can deliver this vital service and improve the environment for staff, for patients and for visitors. Building work should start early in 2024, and thank you to everyone who's donated to the appeal. It's been hugely appreciated. With the appointment of our second colorectal surgeon, we've been able to work with colleagues in Powys to provide clinics in Newtown, avoiding the need for patients in the Powys area to travel Bronglais or indeed further afield. We hope this new service will be up and running very early next year. And looking further forward, the business case we submitted to Welsh Government last year set out our desire to invest over 100 million in the hospital at Bronglais to improve the environment and further expand services on offer. We also set out our aims and ambitions to develop integrated care centres in Aberystwyth, to take forward the Kilcaron project in Tregaron with Ceredigion Council partner, which will then complete our network of local integrated care centres across the county. So it has for me been a remarkable journey over the last 9 years, a journey sparked by Marcus Longley's report, itself the result of a public desire for the voices of rural Mid Wales to be heard. The pandemic has, of course, had a huge impact which will reverberate for a long time to come, but the foundations and work done to secure the future of our services in Mid Wales prior to March 2020 and the strong sense of partnership forged with public sector colleagues during the pandemic does, I hope, mean there's a positive future ahead. Conferences like these will ensure the voices of our rural communities continue to be heard, and I hope it remains a feature of the annual calendar. Whilst I may be heading to Devon, I am remaining a local resident and will be willing you on from the sidelines. Thank you, conference.
Thank you, Steve. Thanks for that. I'm not sure whether Carol has frozen or not, but we'll find out that in a moment. In terms of where we're at. So it is now, let's open up to questions. I'm assuming we're monitoring online as well. So is there any questions in the room for any of the chief executives? There's one at the back, right over there. It's a long trip. Could you say your name and who you are before you give your question? Thank you.
Question relates to training for people in the workforce, social as well as health. Just wondered what priority in this financially strapped situation, what priority is training given in the plans for the future?
Okay, Hayley, would you comment on that first?
So thank you for the question. It's really important when it's the key priority, because fundamentally what we're trying to do is to retain the staff that we've got and make sure that we reduce the reliance on agency staff, etc. So just for us in Powys, as an example, we established the Powys Health and Care Academy. Julia's here, expert here from Powys today to talk about this. But the whole purpose of the academy was to bring together training and opportunities across a number of professions, including sectors. So our academy is not just for the health board, it's social care, volunteers. We've got a school of volunteers and a school for carers as well as part of that work. So really critical piece of work, and we'll be continuing with that agenda. I don't know whether Steve or Carol wants to come in.
Steve, do you want to add anything to that?
I think just to say, yeah, very, very similar to Hayley, really. Training looking after our staff, enabling our staff to develop, enabling staff from health and social care to train together, to work together, is absolutely a key priority for many of the reasons that have been set out in the presentations. That's both to support patients and a growing elderly population and a growing population with health needs, as Carol pointed out, things like diabetes growing, but also to ensure that we are able to support our workforce to be the very best that they can be, which has been a key priority for Hywel Dda for many years. So expect training to continue to be a key priority, regardless of the financial challenges we face, and in fact, in many ways, will help us to address those financial challenges.
Carol, is there anything you'd like to add?
Yeah, can I just give a shout out for further education? And I don't know if there are colleagues from further education in the room. You know, we often talk about doctors and nurses and therapists and training in relation to those groups, which is, of course, fundamental. But also thinking about the broader skills. The NHS needs plumbers and mechanics and cooks. You know, these are the things, these are the skills that keep the show on the road, so to speak. And so I was at a community centre in Ynysmôn recently, and we were talking about the shortage of cooks. And of course, that makes a big difference to, you know, how we look after people, both in our community, but also in our hospitals. So there's the NHS has got a whole directory of roles, and I think we're about training and supporting everyone.
Well, thanks, everybody. I know we've got a question online, I think, from Tom Brooks. Tom, do you want to come in now?
Yes, I'm Tom Brooks. I'm long retired from health care management, but I'm still very involved with patient issues. And I was very pleased that both Carol and Steve referred to Marcus Longley's work with the Mid Wales Healthcare Plan. They could also, of course, have gone back a bit earlier to the Rural Health Plan with Professor Elliston Morgan. And we've made a lot of progress against both of those plans, but we haven't delivered all of them by any means as yet. But over the last 9 years since Marcus Longley's plan, the international scene, as far as healthcare is concerned, has transformed. It's now very much tied up with digital activity. Carol mentioned some of the AI aspects going on. In fact, last year at this conference, I gave a presentation on AI in international sort of medicine, as it were. And looking around the world, it seems to me that it's now most timely for us to have a new plan for rural Wales, for healthcare and for social care in rural Wales, which really lays down the groundwork for using the new technologies so as to deliver what the people in this area want. We do have this independent IMTPs. They don't always interface in the way that many of us would sort of like. And so I think that a new plan for rural Wales to deal with the new world is something which is badly needed.
Sorry, Steve, do you want to come back on that?
Yeah, thank you, Tom. Thanks for the question as well. I just wanted to say, actually, we've got our digital plan, which is the sort of digital version of the infrastructure plan that I referred to in my speech for a healthier Mid and West Wales, coming to our board in November. And I think you're spot on. We really need to think about how we use digital in its widest sense. So at the moment, some of the basics aren't great in the NHS, and we've got to try and join that up. So for us, there are probably 4 priorities. One of them is to ensure that we can reduce what the sort of technical people in the system call the friction. So it's patients being able to easily get access to results, to appointments, to be able to find their way around, and ensuring that helps. That will help with making us more efficient and making it a better service for patients in the first place. The second is around looking after our staff, both in well-being terms and using digital tools for that, but also to ensure things like training and other things are done in the best way possible. The third is around sort of situational awareness, how we how we ensure that we can in the moment, given the huge pressures that we face, particularly as we go into winter, know where our services are, know where our staff are, our empty beds, our ambulances and so on. And that people like our bed managers, who are long suffering, have probably some of the most challenging jobs in the NHS, are able to manage in those moments and know the overall situation. And then you can do that over weeks. Some quite exciting stuff there. The bit that I think is sort of most exciting in that for me, though, is the fourth bit, which is if we can sew together, again, what the technical people call the data fabric, so we can join together health, social care, other data, you start to create an environment where things like AI can really come alive. We have AI working at the moment in Glangwili Hospital. It's in the emergency department, and what it does alongside the staff is it looks at the records of people coming in through the front door, and it tries to predict based on that and based on its clever algorithms how long they might be in hospital, so that we can line up things like the social care assessment if needed at a very early stage. I have to say it's not brilliant at the moment. It's about 55-60% accurate, and that's because it doesn't contain data, say, from primary care or social care, which would give it more ability to predict. But if we can sew all of that together better, not only will, as Carol mentioned, we get better at things like diagnosis using this really clever technique, but also we'll get much better at ensuring that we can be anticipatory for people's needs. We can predict what people might need and get there early, whether that's in the preventative space for people's health, or indeed as people are coming into hospital to make sure that they get the best level of service that they can. So I commend you to have a read of it. It's quite readable for a digital plan. It is quite exciting, I think, from our point of view. It isn't, as have been in the past for me in my sort of 30 years experience, just a set of applications, a sort of set of widgets. It is actually a vision for how digital can help to unlock and deliver on some of our challenges. So thank you for the question, because it helped me to wave the flag for what's coming to board at the end of this month.
Thank you, Steve. Anybody else got anything that they wish to add to that? Yeah, Hayley's gonna.
Just one point. It's a really important question that's been raised, and I think the first thing is, how does the new national refresh to Healthier Wales address rural communities? I think that's important for us to focus on. How do we participate in the work of the Bevan Commission and make sure that that's covered off? And I think finally, at an organisational level, we're asked to develop plans. I think we've previously brought a composite of that across Mid Wales, and I think we can do that. There's a timing issue there at the moment, and I'd suggest probably early in the new year is a good time to bring those together.
Thanks, Hayley. Thank you. Carol, anything you wish to add to those answers?
No, not really. I think, Tom, keep us on our toes over the coming years on this agenda is what I would say. And it's great to have your ongoing contribution, having been in the service and having some insights into I guess the way in which we could change and adapt. So thank you very much for that.
Thanks, Carol. If there's one thing that Tom does, it's keep us on our toes. So thank you, Tom, for that. Okay, I've got another question online first, and then I'll come to you in 1 second, if that's okay. And that is, I wonder what we can do as professionals in healthcare to increase clinical trial capacity and access for those in rural areas. A really important aspect of work, really, in terms of and in terms of equity and access of the population. What are we doing in rural areas with regard to trial capacity? Carol, do you want to come on that?
Well, I do. This is quite close to my heart, because having been in Powys, I always felt that rural populations didn't quite get a fair crack of the whip, so to speak. The other thing, of course, being in Powys, was that we were hosting the Health and Care Research Wales function for Wales, and often, when we were having our sort of annual review, we would be talking about clinical trials. Of course we would. Some of the challenges about accessibility, so how frequently would people need to have blood tests, follow-up, etc., but also building that more remote access to trials, and having those local hubs. So for sure this is a challenge, but that's not one that surely is insurmountable now for us. Tom talking about digital, Steve talking about that, and our sense of our appetite, and we can find ways around that. But I'd also like to fly the flag for research that sits beyond the randomized controlled trial arena. And I hope I'm not offending anyone in the room, but often, you know, we've not really grappled with that broader social research, the stuff that really makes a very big impact on how we work in a perhaps a less scientific way. So I was really pleased to see a greater emphasis on some of those social research developments, and I'm a very keen listener to people like Hilary Cottam, who talk about those social models of health and the return on our investment when we do things differently. So there's room for all of these. But I think, and Hayley was mentioning a healthier Wales, why don't we push this message quite hard that we're after equity for people who live in highly rural areas for their access to trials. Thanks, Peter.
Thanks for that, Carol. And Steve, I'm assuming from a social model for health point of view, you would want to come in?
Well, probably on a couple of things, if I may. I mean, I don't often get the pleasure of opening many things, cutting ribbons, but I was there to cut the ribbon on the new clinical trial facility in Bronglais, not very long ago now. That's the third one we've now been able to set up in Hywel Dda, and clinical trials really starting to develop at Bronglais now, which is hugely positive to see, because I absolutely agree with Carol. It shouldn't be down to just the rural areas, the urban areas who have access, patients in those areas. This is really important for our local communities and indeed for our staff who really value being able to be involved in these things. And there's already, I think, 3 or 4 trials underway running out of Bronglais clinics at the moment. So that's massively popular. On the issue of social innovation, yeah, I couldn't agree more. We've had something in Hywel Dda called TriTech for a while. It was quite new and innovative at the time. Essentially, the idea was that private organisations who are developing medical devices could come into our clinical engineering teams, and those teams would test those devices for them, test them in the real world, and help them to get the various accreditations, kite marks, and actually for many of them then go on to not just produce those things for the NHS, but also to export to it, and that being a real foundational economy step forward for us. We're in the early stages of trying to get our head around how we might do something similar in the social innovation space, the sort of things that Carol mentioned, that Hilary Cottam, also a great inspiration to me, has been talking about. And I'm seeing, as I go around the patch, lots of things bubbling up now from local communities in Borth, in Haverfordwest, in Lampeter, in Cynhadledd, Llandovery, of communities coming together, sparked by different people quite often. Some of them are health, some of them are local authorities, and some of them are just the local community coming together, who are coming up with really interesting social innovations. What we want to try and create is an environment where we can receive those, help to test them with those communities, and then see and help them to roll them out for the benefit of the wider population. So I'm quite excited to see where that goes, and to use this sort of TriTech model as a way potentially of really putting some drive behind that, because I think it's really important to our future.
Thanks, Stephen. Maybe there's something from a Mid Wales point of view that we could do together on that social model and that sort of work. So that would be really useful. So I've got a question in the room now, and in terms of, thank you.
Moving forwards, fiscal challenges.
Go first on that one.
I think
We didn't hear the question. I think you were on mute at the time. So, Hayley, it might be down to you.
repeat the question. Sorry, we're
Sorry.
partly muted, so I do apologise. Can you hear okay now, guys?
Yes.
There's been a lot of moving forward fiscal challenges. Will there be an ongoing commitment to commission the third sector to tap into what we can effectively provide to support positive outcomes to reduce long-term costs? Now, just to give an example, from our perspective, safer warm homes which reduce the impact of health conditions and maintain people's independence in their own homes as long as possible, preventing admissions to hospitals and also getting people home from hospital faster and lowering readmission rates.
Yeah, so from a powers perspective, this is a key priority that we've discussed, not just as a health board, but also in the regional partnership board. So yes, we are fully committed to continuing to fund the third sector on an ongoing basis. It is dependent on outcomes and it is dependent on the contracting and commissioning sort of information that's shared. But in clear from the example this morning or this afternoon, as well as the work that we've done, the return on investment when we actually secure services from the third sector is much higher than what we can do as a statutory sector. So we will continue to work alongside our third sector partners. We are particularly looking at the moment in the regional partnership board space and in the health board space about whether we can increase the horizon of funding for some key services. So at the moment it's an annual process. So we are in our next regional partnership board going to be talking at potentially a 3-year horizon for funding for key projects that deliver the right outcomes for our patients and for the population as a whole.
Thanks for that, Hayley. Again, a really important point there, just before I bring the others in, around commissioning and contracting arrangements, and are we all ready for that? Because that is a new world to some of the organisations that we need to think through. Carol, did you want to come in?
Yeah, can I just take a slightly, thanks very much for the question. I think we captured most of it. The sound wasn't brilliant, but I think the question was largely around the commitment to the third sector. So I think there's a couple of things to say to that. It's yes and. So I think often, you know, we get into the sort of statutory sector wants to buy something, and where does it go? Goes to the third sector. I'm very keen, and we have done this to a large extent in powers, but very keen to be planning services with the third sector and with communities as equal partners. So I think there's the emphasis on what's the art of the possible, because I can just say that the statutory sector doesn't have the monopoly on good ideas. Actually, people who are rooted in the community often have the very best ideas. So it's about bringing that thinking to the table. And then, yes, absolutely, the commitment to the third sector. I don't think that government or anyone's been wavering that commitment. But we are, of course, going to have to think about doing things differently, and that value for money, return on investment. And as Hayley quite rightly said, often the cost-effective nature, just to talk about the fiscal part of your question, means that the community response is often more cost-effective than a statutory sector response. So we're all going to have some tough budget discussions as we go through, and hopefully our partnerships are strong enough to be able to rise above the day-to-day and think strategically about where our best outcomes come for the people of our region. So thanks very much for the question. I hope that was sort of near the answer you were looking for, as we didn't catch all of the question online.
Thank you, Carol. Yeah, exactly the question that we wanted the answer to. Steve, do you want to come in?
Yeah, I'm just a really important question, sort of now more than ever, given the scale of the challenges, financial challenges, not just in the NHS, but being felt particularly keenly in the NHS. I think one part of reassurance I'll give you, not to repeat what Carol and Hayley have both said, because we all think the third sector is providing services that are hugely important to us, is we do need to ensure, and we, as health boards, as organisations, that we resist the temptation for short-term gain for long-term cost. And we know much of what our third sector provides is providing long-term benefit for our population that without it would create further costs for us. So you have our assurance that in a world where I've never seen the sort of financial deficits that are being forecast across the whole NHS in the UK, that we are trying to ensure that we are guided by that principle. And I think for me, I mentioned Borth earlier, just one thing to add to it is that in talking to the community there and the councillor who've been really active in bringing things together, it quite often isn't money actually that the third sector want. What they need is a bit of time from the right people and maybe facilities. So I also think we need to an extent, be able to provide other things, provide support, but let our voluntary sector really flourish and do the things that they do best, because we can be a bit of a deadening influence when we get involved. And I always, having contracts and outcomes strikes fear into my heart when I talk to the third sector, because it can be quite difficult to deal with. So I think we've got to be creative, but what we've got to create, I think, is a social movement of change and support for communities, particularly our rural communities in Mid Wales.
Thank you, Steve. Thanks for that. And we're back to that lone dancer again, the social movement stuff. So really important. We are just about out of time now in terms of this session that was programmed to finish at 4 o'clock, and we're just about there now. So I'd like to thank the chief executives on behalf of the conference, and thank you for your time this afternoon, because I know you're very busy people and there's lots going on within your lives at the moment. So thank you for your time this afternoon. Thanks very much.
Diolch yn fawr iawn.
Thank you.
Okay, we are reaching the end of today. Obviously, tomorrow brings other opportunities, and we look forward to rescheduling tomorrow and re-meeting tomorrow morning to start again with a new set of presentations and new thinking. One of the things that I think we need to really reflect on, though, today is that listening and that involvement with our communities. That's a theme that's come through quite a lot in terms of where we're at. And the theme of partnerships has come through significantly today in terms of our learning and our thinking. And one of the things that I think there's always a danger of in terms of going forward and in this fiscally challenged world that we're in at the moment is that drives our agenda. And we need to be really, really careful that we continue with the partnership working, we continue with the third sector working, and we listen. Because listening is a real gift for us in terms of taking things forward. Thank you for coming today. For those that are staying on for the joint committee meeting at 4:30, there is tea and coffee available to refresh yourselves before we start the next round. Thank you all very much, and safe journey home. Thank you.